So diuretics are most commonly used for congestive heart failure or chronic heart failure, and they use it to reduce preload by reducing the plasma volume. So blood volume increases as much as 15 to 30% during states of chronic heart failure, and where most of the extra blood volume remains upstream in the affected cardiac chamber. This includes the pulmonary veins and the capillaries for left-sided heart failure, and the systemic veins and the visceral organs for right-sided heart failure. As the intravascular pressure increases due to the extra blood volume, it also increases the fluid in the interstitial space and the body cavities, and this causes edema and effusion. So diuretics help to reduce the edema and the fusion by decreasing the total amount of intervascular volume. And they do this by increasing the renal water excretion. And there's some major classes, there's 4 major classes of diuretics used in veterinary medicine that you may see. When it comes to heart failure, the most common are loop diuretics, thiazide diuretics, and potassium-sparing diuretics. When you're using diuretics, you want to make sure that you are monitoring kidney function and electrolyte functions, and patients should always have access to water. So basically, edema is when the pumping ability of the heart is impaired and water can be retained by the body. And this is an effort to compensate for the inadequate cardiac output. And this leads to edema in various parts of the body. Generally, it's in it flows, gravity is not our friend in this case. And so you'll end up seeing it in the swelling of the feet and the swelling of the legs. And sometimes it can be called pitting edema. And pitting edema, you can actually put your finger into the spot that has the edema, and the finger will stay, the print of the finger will stay in that area. So I like to remember diuretics with this acronym, and the acronym is COLD-P. And it is sequential to the site of action along the nephron. So COLT meaning carbonic anhydrase inhibitors, osmotics is the O, L as in loop, T as in thiazides, and P as in potassium sparing. So basically diuretics make you pee like a racehorse. So here is how they work along the loop there. This is on the glomerular. So this is the glomerular filtration. If you can see right about here is where the carbonic anhydrase inhibitors work, and it works in the proximal convoluted tubule. And then you have osmotics, and these osmotics pull out things like chloride, sodium, H2O, as well as highly lipid drugs. So those pull them out in that spot. Right here is the loop of Henle, and this pulls out chloride as well as potassium. And then you have thiazides, which work here on the distal convoluted tubule, and these also pull out water and sodium. And then you have potassium sparing, and these basically just pull out H2O. And these all kind of work along the lines of trying to get fluid out of the system into the kidneys and then out of the bladder so that they excrete them out. So carbonic anhydrase inhibitors, diuretics, these block the action of the enzyme carbonic anhydrase, and this is what the body uses for maintaining acid-base balance. These drugs are really used for decreasing intraocular pressure, especially with open-ended glaucoma. The main side effect of these is metabolic acidosis, and some examples are acetylzamide or dichlorphenamide. And these really don't have much to do with the heart. They're just kind of in that COLT-P acronym. So furosemide is a loop diuretic. It's the most common loop diuretic used in veterinary medicine. It's used to treat congestive heart failure, pulmonary edema, and hypercaloric neuropathy. The therapeutic doses have a wide margin of safety since the toxic dose is about 3 to 4 times the therapeutic dose. It can be administered orally as well as parenterally, so sub-Q, IM, or IV, and it can either be given as a bolus or a CRI. CRIs have been shown to increase more urine output and then minimize alterations of electrolytes more effectively than if you give a bolus injection. The onset of action of an IV bolus administration is about 5 minutes. Peak effect starts within about 30 minutes, and duration of the effect is about 1 to 2 hours. Oral bioavailability is about 50%, with onset of action about 60 minutes, and again, peak effect 1 to 2 hours, and duration of the action is about 6 hours. The duration of action depends on the adequate renal blood flow, the state of the renal hypoperfusion. So hypoperfusion will decrease the efficacy, and higher doses may be required if an animal is in renal failure. Cats seem to be more sensitive to furosemide than dogs do, and so they may have to be dosed every other day. And this might have something to do with the liver and the enzymes that are needed to break this drug down. If you give oral tablets of furosemide, you need to make sure that the owners protect those from light. The injection may precipitate if you refrigerate it, but if you take it out of the refrigerator and let it warm up, the precipitate should go away. It is compatible with most IV fluids, so you could add it with LRS or normal SOLR. It can be incompatible, though, with dopamine or epinephrine, so you don't want to mix these drugs, and you don't want to mix furosemide with an antihistamine or a local anesthetic. Furosemide may also cause systemic vasodilation and reduce renal vascular resistance, so it may help increase renal blood flow, and it's also can be a potent transient increaser of glomerular filtration. Some adverse effects of furosemide would be ototoxicity, especially if you give it in rates above 20 mg per kg. It can cause profound dehydration, mild to moderate hypokalemia, and hyperatremia. And in dogs, potassium is less effective than in sodium. So hypokalemia can cause muscle weakness and cramping, and it also can cause arrhythmias. So another diuretic that you might see used is potassium-sparing diuretics. These diuretics function on the aldosterone antagonists, and they block the reabsorption of sodium in the distal and collecting tubules of the kidneys. So they result in an increase in water and sodium excretion. They are the least potent of the diuretics and should never be used alone, so they're generally used with loop diuretics like furosemide. They do provide an added benefit in a patient that has hypokalemia because they decrease the potassium wasting effect. Another benefit of using potassium-sparing diuretics is that when you are using them to treat congestive heart failure, is that the aldosterone agonists, they target and modulate RAS. And that's really important to enhance the degree of, because RAS, it enhances the degree of heart failure by its fluid retention effect and the development of adverse hypovolemia. So potassium-sparing diuretics have minimal adverse effects. They may cause some GI upset. They are contraindicated in any condition or combination of a drug that can result in hyperkalemia, like Addison's disease, anuria, or acute renal failure. And the most common potassium-sparing diuretic that you will see is spirolactolone. It is an aldosterone agonist. Its oral bioavailability is greater than 90%. Peak effect occurs within 2 to 3 days after giving the initial therapy, and it remains effective about 2 to 3 days after you discontinue it. Another type of diuretic that you may see used is a thiazide diuretic, and these work on the inhibition of sodium chloride co-transporters in the distal convoluted tubules of the kidneys. So they inhibit sodium and chloride reabsorption and they enhance water excretion. Thiazide diuretics are less potent than loop diuretics, and they're considered ineffective when they have low renal blood flow. Therefore, they rarely use these as a first-line therapy. Usually they're called rescue diuretics, and this is in animals that are not responding to those loop diuretics. Sometimes they'll use them to treat hypertension, as well as reducing polyuria and diabetes insipidus, or water diabetes. So the bioavailability in humans is 10 to 21%, though in dogs they think that they are absorbed better. Onset of action is about 1 hour, with peak effects being 4 hours, and duration is about 6 to 12 hours. Adverse effects of thiazides are increased potassium secretion, which can lead to hypokalemia. They can cause some dermatological reactions. They can cause hyperglycemia, as well as some hematological toxicities. So you'll want to be careful using these drugs, and you want to make sure that if you're using them with patients that are diabetic, that you reevaluate their insulin requirements. So probably one of the most important things in managing heart disease is dietary. We want to use dietary management of heart disease because we want to restrict the sodium. By restricting sodium, this decreases the water retention. You also want to use a diet that has a healthy protein that can help maintain the body condition, because chronic heart failure tends to lead to cachexia, which is wasting of muscle, as well as weight loss. You can use like omega-3 fatty acids or fish oils to help maintain the healthy body condition. You'll want to use a diet that's rich in taurine and carnitine. These are both carnitine is an amino acid, taurine is an amino acid. Carnitine is like an amino-like acid, and carnitine works with the cells and helps with energy production. You also are going to want to manage concurrent diseases like kidney disease. You want to make sure that you're monitoring electrolytes. So some other treatments that you may be using in patients that have heart disease or cardiovascular issues, the acronym for this is BOATS. So bronchodilators, this allows the blood to be more efficiently oxygenated. You may use oxygen, especially if the patient has some pulmonary edema. Obviously, they'd be in an oxygen tank. Aspirin or antithrombotics, they use these to treat heartworm. They can be, they use it in heartworm treatment. It doesn't kill the heartworms, but it helps with clotting. Congestive cardiomyopathy in cats, aspirin is going to be used like once every 72 hours in these cases. T is thoracentesis or abdominocentesis, and this helps to remove the effusion or the fluid in the abdomen, as well as effusion in the lungs, and you may need to use sedation. And patients become very anxious. They can't breathe. This leads to hyperventilation. This then increases oxygen demand, and then this in turn causes anxiety. So just a few other cardiovascular drugs. Anticoagulants, these are drugs that inhibit clot formation by inactivating clot factors. They'll prevent clotting in catheters. They prevent blood samples from clotting. They can use these to preserve blood transfusions, as well as to treat emboli in animals. Some examples of anticoagulants: heparin. They use this to help prevent clotting in catheters. They may use a heparin flush. Please be aware that heparin comes in 2 different concentrations. You want to make sure that you're always using the proper concentration when you're making your calculations. Deltaprin or enoxaparin, these are low molecular weight heparins. Warfarin, this is a drug that's used in clotting issues. It's also used in rat poison. This is what kills mice and rats. It actually causes them to bleed to death. And then hemostatic drugs, these are drugs obviously that promote clotting of blood. Vitamin K, this is used in rodenticide poisoning. So animals that have accidentally gotten into warfarin, you may use some vitamin K. It works in the liver, and helps with clotting of the blood. Silver nitrate sticks, this controls capillary bleeding by constricting down tissue. And then hemostat powder, again, controls capillary bleeding in superficial cuts, or like if you quick an animal. That is cardiovascular drugs. If you have any questions, please let me know. Thanks.